Typical cough involves a deep inspiration, tight closure of the glottis, quick and forceful contraction of the expiratory muscles, and then sudden opening of the glottis while the contraction of the expiratory muscles continues. High intrapulmonary pressure is generated. Once the glottis is opened, a blast of air expels foreign particles or secretions. Cough can be impaired when the glottis fails to close tightly or when respiratory muscles are weak or paralyzed, limiting inspiration and strong expiration.